Hi everyone, Big Papa Scott here. Figured today we talk about congenital heart disease. Congenital heart disease is heart disease in children or acquired, or not acquired, but heart disease that you're born with. There are many forms of congenital heart disease, too many to discuss in one session. I will try to cover most of them as time goes on. My subspecialty or specialty was congenital heart disease in the sense that I worked with kids almost all of the 33 years that I worked in cardiology. So children are amazing and they're much more resilient than adults, and they bounce back from congenital heart surgery a lot faster than most adults bounce back from coronary artery disease heart surgery. So it's an amazing thing. So we'll start off, I want to show you something. These are the kind of babies that I worked with quite a bit. This one has obviously had open heart surgery and actually looks like they've pulled some of the tubes and things are going well with this baby, which is good. But you can see that there's quite a bit of stuff to work around, and there's also, been a big operation that has taken place, and you just have to be careful. And there's always tubes hanging down and wires and lines and everything like that. So it's very important to be careful with the machine and be careful while you're doing this. So, but I did want to show you what a baby can look like after open heart surgery. So. And some of the surgical procedures we'll get to now. Now each baby can be born with different heart problems. They can be singular, they can be multiple. I've seen babies born with the great arteries, which are the pulmonary vessel, which is here, and the aortic vessel, which is here. I've seen babies where that's switched, where this one is over here and this one is over here. So it completely screws things up because you have oxygenated blood going to the lungs and deoxygenated blood going to the body. When a baby is born, there's a small little tube that connects the aorta to the pulmonary artery. When a baby is born with this defect, which is called transposition of the great arteries. So if this is one of the more severe defects, keeping this little tube open is very, very important. And there's usually a hole somewhere around here that also helps blood mix between the left atrium and the right atrium. So I know this seems complex, but I just wanted to show you some of the things that can happen. I mean, there's so many little things or big things. This is a big thing that can happen to a baby. This requires surgery, pretty quickly. They usually go in when the baby's, sometimes a couple days old, and, go in and fix this as quickly as possible. Most of the time they can just swap out the vessels and put them in a different place, but sometimes there's other issues that can come up too that will cause them to do other things. So I hate to be so vague, but if I were to get into a full explanation, this thing would be an hour and a half long, so we don't want to do that. There can also be more minor defects that a child can be born with, such as a small hole between the two pumping chambers down at the bottom of the heart. So a small hole that allows blood to go from the left heart to the right heart. Now if this is a very small hole, it usually closes itself, usually by the time the baby's 6 months, but I've seen them open in 7-year-olds, so I saw one time in a 72-year-old lady, so it just depends upon what happens. As long as the right side of the heart, the right ventricle and the right atrium don't become enlarged. So if they were to get much bigger, you would have a problem. That means there's too much blood going over there, and it's enlarging the size of the chambers. And that enlargement can also cause, in the pulmonary artery, can cause a higher pressure. And that pressure being higher can cause the baby to have quite a bit of shortness of breath. So if this hole is too big, then it has to be fixed. Usually the ones that are down here, they will close themselves. Same thing with here. Usually they'll close themselves. But if you get up into here, those babies a lot of times have to have surgery to repair that. And the reason being is because it can cause the aortic valve, which is right here, to start to leak. And if that starts to leak, then you're asking for more trouble, because the valve will start to fail, and then you'll end up replacing the valve and closing the hole, which is not good for a child. So they like to fix these relatively quickly because they don't want it to ruin the aortic valve. The next one I want to talk about is something very severe that unfortunately takes a lot of children, babies, away from us. It's called a hypoplastic left heart, which is where the left side of the heart is underdeveloped. And it can be underdeveloped for lots of reasons, but what ends up happening is sometimes there's almost no mitral valve or just a tiny little hole going through it. The left ventricle is very small, so this would be all just muscle. And sometimes the aorta, which you see is kind of wide here, and there's a normal aortic valve, will be very small, and there'll be an abnormal or almost no aortic valve or a stenotic aortic valve. And a lot of times the whole aorta is small. Well, this obviously is a very big emergency, and without some sort of communication of blood flow between the right heart and the left heart, usually up in the atrial septum, but it can be down here too in the ventricle. If there's not some communication, then the baby will die. A lot of times the only blood flow the baby's getting to the body is from this little tube that goes here. It's called a patent ductus. And if they don't keep that open, the baby will die rather rapidly. So there's medicine to keep it open, which is good. But this is an immediate surgical heart procedure they do. Usually what's called a Norwood procedure, if I hopefully spelled that right. But that's a procedure that kind of turns everything into one ventricle, and they enlarge the aorta with what's like a dacron, which is a heavy plastic that's weaved, and it will buy the baby some time, and then there's usually a couple other surgeries that will go along with this as time goes on. It's a very long process. For a while they were just trying to transplant these children, so they would try to get a donor heart and put in a new heart for the baby. A lot of times if this is severe enough, they'll still try to do that. So I can give you an idea of how severe congenital heart disease can be. This is life or death. When I was working in pediatric cardiology, 10 or 12 or 15 years ago, about 50% of these children died. So the numbers are better now, but it was that significant because even the best surgeon would have trouble fixing this. So another severe congenital defect that I wanted to show you that does happen. You can also have some milder problems, like I talked about the VSDs or the holes that can come down here. There can also be what's called an ASD, which is a hole up here. Depending upon the size of that, if it's too big, they have to go in and patch it. If it's smaller, They can actually go in the cath lab and fix it with a fancy catheter that deploys what looks like two umbrellas back to back and closes the hole. It's pretty amazing. But there also can be, like this is the pulmonic valve right here, that can be stenotic. A child can be born with that being really narrowed and not opening well. It's called pulmonary stenosis. And the blood flow is very limited to the lungs. A lot of times they can open that up with like a balloon. It's on a catheter, and it inflates in the artery here, and it kind of opens the valve up itself. It works pretty well, but sometimes the valve will restenose after time, but it's kind of a quick fix, which is good. They can also deploy a new valve, an artificial valve, through a catheter and put it in there. A lot of different things that they can do, but this is one of the more treatable heart problems that we see. It's relatively simple to see on an echocardiogram, which is what I did. But stenosis, just like with older people, can be found in children too. So it's much rarer. The pulmonic valve stenosis is more common, but aortic valve stenosis and mitral stenosis and tricuspid stenosis, especially tricuspid stenosis, are extremely rare. Every once in a while I see an aortic stenosis on a child, but it's pretty rare. It's mainly the pulmonic stenosis that we see. There are so many more congenital heart defects that we could cover. It's like I said, it's just that I don't have the time to do that. Like I said, the video would be so long it would be ridiculous. I just wanted to hit on a few things just to give you an idea of how severe congenital heart disease could be, and also how it can be a little bit milder thing that's causing a heart murmur, and we find out what it is, and maybe the baby has an echo done every 6 months or every year, and we just follow it and make sure that everything is okay. But it's important to know that if the doctor hears a heart murmur on a baby, that you get an echocardiogram done as soon as possible. So if you go to your pediatrician and they hear a murmur, you're going to want, they're going to want to get an echo, and don't delay, go get it done. I suggest you go to a big city hospital like a university or something of that nature, because you want a registered tech doing this. So what I mean by registered is someone who's trained in pediatric cardiology. And the reason why is because they have seen quite a bit more than an adult tech, and in some of the smaller hospitals they only have adult techs. So go to a big university hospital, make the drive, it's well worth it, have the echo done, and if there is something significant, you want to follow up there at that hospital, the big hospital, because they're used to seeing these kind of things. So anyways, that's my advice. And if you have any questions or comments, just leave them in the comment section of the video. If you maybe want me to explain something else on congenital heart disease, I can try to explain it for you. And I appreciate it if you would subscribe and like the channel. I would really like to make this a normal thing that I do all the time. So anyhow, it keeps me out of my wife's hair at least. So I hope to hear from you in the comments section. Have a good one.